Hi, happy Motivational Monday. It's the nursing professor, and today I'm going to call this the clinical edition because I have gotten so many questions, so many statements about students not feeling that they're getting the best out of their clinical rotation. And that's for a whole host of reasons that we're not going to address in this particular video. But let me give you some helpful hints that is going to make this week's clinical experience a lot better for you. All right, so first you're going to get your assignment. So you're going to get your assignment. Your instructor is going to tell you to go with this nurse. The nurse is going to look at you like, okay, I got a student today. Sometimes nurses aren't so welcoming, but we're going to get through that. Okay, so you're going to go with that nurse. You're going to introduce yourself. You're going to tell that nurse what you expect to get out of this clinical experience and share with him or her that I'm learning about the respiratory system. Do you have any of your patients have respiratory problems that I might be able to focus on? Even if they need some assistance with something because they're short of breath, then maybe I can help them go for a walk. Maybe I can help them get out of bed. And of course, when you do these things, you're going to make sure that your instructor knows that you're actually doing these things. But I tell you, it is going to create such a learning experience for you and the nurse who's precepting you that day, because that nurse knows where he or she needs to focus. All right. And you're just not following them around, feeling like you're not doing anything. Also, never be too proud to, once those patients have been identified, to say, well, can I go with the tech? Because the patient tech, the nursing assistant, whatever the role is called, will know a lot about that patient. They'll be able to tell you that that patient can't do this. You'll be able to assist in performing ADLs for that patient. And again, learn a lot from that. All of learning doesn't have to come from walking behind a nurse as they're doing their duties, because it becomes twofold. Nurses have a lot to do. All right. And secondly, you don't know enough to know the right questions to ask for the most part. And so sometimes that relationship can be really, really strained. But you identifying up front, this is what I need to achieve today. All right. So you go and do that now. Finish at that point. You've determined that person has poor endurance. You've determined that person needs some assistance with ADL. So already you're either jotting this down on your notepad or you're putting it in your memory bank so that you can recognize that this person has these problems associated with the medical condition that they have. All right. Because nursing is all about pairing the medical condition with those things that your patient can or cannot do. That's all about the nursing process. All right, so next it's time for your nurse to give meds. So you ask the nurse, can I go with you to give meds, especially for these 1 or 2 patients that have respiratory conditions? And you listen to what that nurse is saying as he or she is given the medications, because they have to tell the patient what they're giving them. You will even get an opportunity maybe to see an inhaled medicine given, like a nebulizer treatment. If the person has respiratory in the room, ask if you can stay. Ask respiratory some questions, because that is going to create a much better learning experience for you. If your patient needs to go to CAT scan or x-ray or physical therapy even, and they need to go off the floor, ask if you can accompany them, because again, you'll get to see how the other disciplines work in an effort for interdisciplinary care to happen to improve the outcome of your patient. It's a much better learning experience. And all the while, keep your nursing instructor informed of what is actually going on if he or she is not around. All right. Last but not least, after you've done all of that, ask your nurse to see if you can get a printout of your patient, which includes like medications, admission date, no private health information. You don't want any name. You don't want any date of birth. You don't want any identifier on that piece of paper. They can even tear it off for you, because sometimes students will leave stuff around or it'll drop. It can get in the wrong hands. But if you have that information, then you can go sit somewhere and you can organize it in the way that's going to make sense for you. And I guarantee you, when you have that exam on respiratory, you're going to remember that, oh man, my patient in 212 had this in that scenario that's given to you on that test. And this is what I saw happening. That is the way clinical rotations can be a great asset to your learning, but you just can't sit back. You just can't gripe and complain and sit down and take up all the chairs and do all those things. And I'm not suggesting it's your fault, because as I started out saying, this problem is a problem. And that in nursing education, we got to fix it, because that clinical rotation is invaluable when done correctly. But when it's not done right, it can be very frustrating for both the student and the patient and the nurse on the floor. So I hope this helped. I wish you a great week, and I'll see you next video. Bye for now.